Good to see you, Jerry. Let's quickly begin with the federal government's invocation of the no work, no pay policy. What is your association's response to this latest move by the government?
Good evening. The no work, no pay policy that the federal government mentioned, our stand is that we are not bothered about. We are doing what we are doing. We don't. That is not our priority. We hope that the federal government realize that they are making a mistake and withdraw that quickly, because that will further compound the problem.
Well, when you say this definitely will further compound the problem, your body of doctors have been accused of being insensitive on the strike, especially as it is coming during the COVID-19 pandemic. What more do you have to say to these accusations?
My brother, that accusation is not true, because we are very sensitive to the plight of Nigerians. Hence, we were not willing to go on this strike. We did everything to ensure that this strike is averted, but some agencies of government did not do what they were supposed to do. I haven't signed an MOU with us, and an MOU with us for more than 115 days now. You agree with me that the fact that they didn't do what they were supposed to do led to this strike. I must confirm to you that at a meeting called by the House Committee on Health today, was a review that we were exonerated from all these blames. However, we know that strike is not a good thing for the common for Nigerians, for the common citizens of this country. Hence, at all times, we don't. It's not our weapon to go on strike. But since January, we have been on these issues. For people to be working without salary is something that we cannot comprehend. At the meeting today, you need to be there and see how people that were supposed to handle the health sector are being embarrassed. So it's shameful that this strike was allowed in the first place. And as a responsible association, we are out to see to the resolution of this crisis, not just for this strike, but to forestall the recurrence of the strike. So we are not the cause of the strike, and all Nigerians must know, so that we will, at different fora, we have stated it, all those that led to this strike should be called to book. If you are in charge of payment of salaries and you didn't do that, you as a journalist should help us to call them out. You cannot say that somebody that is asking for his salary is not sensitive. Do you want
let me quickly come in here, Dr. Isogun. Your association's president, Dr. Ohuaisui, has called for the resignation or sack of the Minister of Labor and Employment, Dr. Chris Ngige, who is also a medical doctor. So looking at this case, some Nigerians are wondering, you have a medical doctor in charge of labor, you have a medical doctor or medical doctors in charge of the health ministry, making three key professionals looking at the issues you've raised. Do you think all three are insensitive to your plight, or they understand that your union is insensitive here?
Now, the issue, I must be sincere with you, the three ministers, they are leaders in those ministries. They are supposed to command the people working under them to do the needful. Because there are people, everybody handling these issues are not doctors. It's unfortunate that those that are supposed to lead us, they probably are not led very well. There are people frustrating, their efforts, and I think that they should call those people out instead of coming to blame the doctors that are asking for their right. They should blame the people that are supposed to have done that were supposed to have done this job. Everybody in the Ministry of Health are not doctors. Everybody in the Ministry of Labor are not doctors. So there are people that are supposed to do one or two things that didn't do them. Those people should be called out and blamed for this strike. And if we could have a meeting today with federal government, and in that meeting, it was revealed that we were not at fault, then it's obvious that government, the agencies caused this strike. And I believe that we all, it's high time we galvanize together to ask for, responsible leadership. The people that are suffering presently they cannot afford healthcare outside this country. So why would people in government deliberately plunge us into crisis so that Nigerians will suffer?
I'm afraid that will be all. Dr. Jerry Sogun, Secretary General of the National Association of Resident Doctors. Many thanks for speaking with us on the news.